So now, but last but not the least talk of this particular session, I invite Dr. JYOTIRMAY BISWAS, sir, and he's heading the uveitis and ocular pathology department of Shankar Nethralaya, Chennai. And sir would be telling us the various tips how to handle and make the samples reach him.
So we have got a lot of talks on the techniques and collecting the samples from the lead conjunctiva, orbit, lead conjunctiva, and then iris tissues, as well as that vitreous and fine needle aspiration biopsy and choroidal biopsy, as well as the removal of the eye. I'll be talking about that how we handle these specimens. So particularly in uveitis, etiology of the uveitis, as I don't want to describe in details, it could be non-infectious, infectious, and masquerade. And infectious can be viral, bacterial, fungal, and parasitic. And viral would be varicella zoster virus, herpes simplex virus, cytomegalovirus, measles, and influenza. Bacterial, syphilis, mycobacterium tuberculosis, fungal, Candida, coccidomycosis, and parasitic Toxoplasma toxocara. Pathologic study, various techniques which has been described: anterior-chamber aspirate, iris biopsy, vitreous biopsy, and then retinochoroidal biopsy. We get the biopsy pathology, the techniques, is the various specimens, like, is this the case of pseudohypopian. We get large, basically cohesive cells suggestive of retinoblastoma. And this is a case of a lens-induced uveitis, where you could see the large macrophages laden with the lens material. And this is the fine needle aspiration biopsy of a large cell lymphoma, or this is a primary vitreoretinal lymphoma, where you could see that the necrotic background large lymphoma cells are seen. So when you get a intraocular fluid, that specimens should go for a direct smear. Cytospin is the better, and then culture, PCR, and then immunohistochemistry and flow cytometry. I'll be talking a little bit about it. Cytospin, we use that machine 1000 RPM for 5 minutes revolutions for concentrating the specimens, and what you get, a concentrated smears. And this is a case of metastatic tumors from the anterior chamber aspirate, and we could see that the large cells with hyperchromatic nuclei and scanty cytoplasm. So we get very concentrated smears, and it is easy to make a diagnosis. So how about the culture? Culture is the gold standard, but less sensitive, takes too much time, not practical for virus infection. This is a primary vitreoretinal lymphoma, a diagnostic challenge in the tissue diagnosis, and is mandatory. And here we see that cells are often necrotic and friable. Cytological examinations within an hour is required. There is a several fixation technique is there. There is a hope fixation technique, a promising alternative for common prostatic cancer biobanking approaches, and which can be used in the intraocular lesions also. And then cell block, which you do over there, where the tissues are, the fluid samples is put in the tube and then put in a filter paper, and the method is preparing cytoplasmic material, which can be processed, sectioned, stained, and viewed on histologic sections. Easier to do special stain immunohistochemistry on the cell block slides, requires minimal effort and extremely cost effective. And this is a cell block preparation from the vitreous aspect of a patient with primary intraocular lymphoma. And you can see that a lot of tissues are there, and with the pleomorphic cells, lymphoma cells are seen in necrotic background. What is the advantage of this one? That we have found that is a high diagnostic sensitivity and low pseudopositivity rate, cell block method. And score vitrectomy leads to the poor cell recovery. Partial vitrectomy is better, as is mentioned over there. Primary intraocular lymphoma, alcohol fixation causes post-cellular recovery. Expert cytopathologist is needed. Biopsy technique and yielding is that one large round or oval nuclei segmented with the prominent nuclei with scanty basophilic cytoplasm, as we see over here. This is a cytology on MCG stains, or you can do that H&E stains, cell block preparation, and we use that marker for the T and B cell marker. CD20 B cell marker was positive in this case, primary vitreoretinal lymphoma. Molecular biology is another aspect which is I wanted to highlight about it, particularly in the viruses, which you cannot do that smear or culture, and it has improved the various diagnostic techniques, diagnosis of that one. So it's a kind of a xeroxing or multiplying the DNA segment, and is in a million times it magnifies. Is the reaction sample a primer for the specific detections, nucleotides and enzymes is put into that one. You can take sample from the anterior chamber, corneal surface, conjunctiva, subretinal fluid and the vitreous material, and various organisms which can be detected from the PCR technique. This is a PCR machine, and this is a gel documentation system. And here is the beauty is that there is a positive control and the inbuilt negative control is there. And various infectious agents can now be detected by the PCR, starting from the bacteria, fungus, mycobacteria, even syphilis can be detected with the PCR techniques. Single-step PCR, nested PCR, multiplex PCR, quantitative PCR, and now its next generation sequencing has come. Single-step PCR is a one target, one-step reactions, 20 to 40 cycles, used extensively to detect CMV, HSV, HZB, toxoplasma, gondii. Nested PCR, we use the two set of primers in two successive PCR detection. In the first PCR, one pair of primers is used to generate amplified DNA product. This will then form the target for the second PCR reaction. Advantage is increased specificity and increased sensitivity. Disadvantage is the risk of contaminations, and applications used extensively to detect Mycobacterium tuberculosis gene. Example of nested PCR, this is a patient of dimness of vision of both eyes, and it treated the spheroid and intravitreal triamcinolone acetate injection, and one eye has got vitreous haze, another eye has got exudates. The eye which has got dense vitreous haze, we did a vitrectomy, and we could see that diagnostic vitrectomy was done, and we could see that large granuloma seen from the vitreous cavity with lymphocytes and epithelioid cells. And the PCR came positive for Mycobacterium tuberculosis DNA. Multiplex PCR can be used as a single PCR resection to detect multiple pathogens using multiple primer sets, each targeting particular pathogens. Each primer set generates amplification of specific size different from each other. Advantage is simultaneous detection of multiple pathogens, but it decreases the sensitivity due to the primer competition compared to the uniplex. Conventionally, real-time PCR and reverse transcript PCR is preceded by addition of a convert RNA to DNA, and then it goes an amplifications of the same. Quantitative PCR or real-time PCR can be done where you get the copy number. This is a case of a viral encephalitis followed by the acute retinal necrosis, and we did the agarose gel electrophotogram, which nested PCR was positive, while herpes simplex type 2 and type 1. And quantitative PCR showed 768,874 copies of the DNA. Aqueous human polymerase chain reactions in uveitis, the utility and the safety, and this has been demonstrated by our study. And polymerase chain reaction in the various samples in the viral retinitis is of utmost importance. What's new is that impact of polymerase chain reactions in finding new organisms, metagenomic deep sequencing for the diagnosis of intraocular infections much more precisely, and identification of new pathogens in intraocular fluid in patients with uveitis. So PCR in uveitis is a key laboratory test in the diagnosis of uveitis, prompt, sensitive, and specific molecular diagnosis of pathogenic microorganisms. Metagenomic sequencing will not only aid in diagnosis, but also help to establish new etiologies and clinical entities. So sending the specimen for PCR1 is the ACTF test can be transferred in the syringe used for the collection. The movement should be arrested by sealing the sample with abro tape or adhesive tape. Specimen can also be transferred to the sterile 1.5 ml vials and transported without any preservative and freezing using the ice pack. Last but not the least is that we are doing an MYD 88L265 mutations, which is useful in the vitreoretinal lymphoma, and we can detect the spike in the DNA gene sequencing. And last, I conclude that as your pathology, so is our practice. Thank you.